So I'm here with Dr. Fernando Zagado. Doctor, what can you tell us about non-gonococcal urethritis? What is this disease about?
Non-gonococcal disease is an infectious disease of the urethra, which is a contagious disease different than gonococcal. Gonococcal is the main cause of sexually transmitted disease, but this is by a different microorganism, usually chlamydia, which is the more often of them, and can be very, very dangerous if it is not diagnosed and treated properly.
So how can a patient diagnose that they have non-gonococcal urethritis?
Usually the symptoms are quite similar to those of the gonococcal disease, which is a pain and burn of the urethra, and sometimes it produces some kind of a liquid, a green liquid that can be seen by the people. So that's the main thing about the diagnosis. But also there is a need to do cultures and tests to prove that there is not the gonococcal microorganism. It is another organism, such as I said before, the chlamydia, which is much more often in this kind of diseases.
So we have cleared that non-gonococcal urethritis is a sexual transmitted disease. What could you tell people to prevent this disease?
The most important thing is to avoid the risk of sexual contact with persons that you don't know. Also, there is a need to use condom or some kind of protection and to wash your genitals before and after an intercourse and sexual intercourse. The most important thing is to have the same person to have sex with that person. There is a risk if a person makes sex with different partners, different people, so there is a need to be secure and to be sure that the person that you're making sex is the correct person and don't have a disease.
Do you have anything to say to patients to have this disease?
Well, as I said before, the most important thing is to prevent to get the disease, to use condom and to prevent the risk of having different sexual partners.
Thank you very much.
You're welcome.